welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blaiklock, and our topic this episode is breast cancer. Joining me for discussion is Dr. Amy Braden, hematologist and oncologist with the Cancer Care Center of Heart and Memorial Health, and Dr. Karen Johnson. She's a general surgeon with a surgical specialist with Heart and Memorial Health. Thanks for being here with us.
Thanks for having us.
Let's start a little bit. We know breast cancer is common and obviously a little bit more common with women. Just what are some of the statistics that we need to pay attention to?
Well, breast cancer, as you might know, is the most common cancer in women. It's estimated that about 1 in every 8 women will develop breast cancer in their lifetime.
Wow, so that is something we really need to take heed and look at maybe our own personal risk factors. So Dr. Johnson, what are some steps maybe women can take in their lifestyle to help prevent them from being at risk for breast cancer?
That's a great question. I get asked that every day in clinic. The things that you can actually change, your diet, a low-fat diet, exercise, you really only need about 30 minutes a day, and it can just be walking. Not smoking is a big one. And then alcohol. They say even up to 1 drink can mildly increase your risk of breast cancer, but having more than 1 drink a day significantly can increase the risk
So
of
really
breast cancer.
moderation as far as the alcohol is concerned,
Yes, ma'am.
and not more than 1 per day. Is that what
Yes,
I'm
ma'am.
hearing? Okay. And we know it's definitely tough, especially with women. We all lead busy lifestyles, men too. We don't want to leave that out, but really fitting in some exercise and making sure they're getting at least 30 minutes of exercise, watching what they're eating, and we've heard that before with most everything.
Yes,
And
ma'am.
generally,
Exactly.
these are lifestyle risk factors that we need, not just for breast cancer, but good health habits that we can have, and not eating a diet that's high in fat, and making sure that we're probably eating a lot of fruits and vegetables too.
And it specifically applies to breast cancer because it affects your estrogen levels. So alcohol increases estrogen, fat levels increase estrogen, and so a lot of breast cancers do feed off of estrogen. So
Okay.
specifically for breast cancer, it's very...
Okay, so this estrogen is a hormone that women have. Is that correct, Dr. Brady?
That's correct.
All right, so let's talk a little bit about maybe some of the hormones in the relationship to breast cancer. We know that women, as they get older and they go through menopause, there's also that risk we hear with hormone replacement therapy.
That's right. So it's always a balance, because we never like our patients to feel bad. After menopause, there's hot flashes and other symptoms that hormone replacement can help treat in terms of symptoms. But it's always a balance, because we know from prior data from studies that have been done in the past that people that receive hormone replacement therapy are at higher risk for breast cancer.
So definitely something to talk with your personal health care physician as far as your personal risk factors that you have, because each one of us are different. And if hormone replacement therapy is something for you, and if it does put you at a higher, at higher risk for breast cancer too. Now we hear a lot about genetics and family history. So tell us a little bit about family history.
So with the family history, only about 5 to 10% of breast cancers are actually a genetic mutation that is passed down in the family. And most of those people, your mother or a first-degree relative would have had it before age 50, so sometime in their 40s. It would be multiple family members, like maybe an aunt, a grandmother, and a mother. And those are really you think of the BRCA1 and 2 genes that you hear, like with Angelina Jolie having the double mastectomy or the bilateral mastectomy. More commonly, it is just a sporadic mutation that occurs. And so that's why it's so important for any woman that feels any lump, get it checked out. Even if you don't have a family history.
Right.
Because the majority of breast cancers happen in people who don't have a family history.
So speaking, let's go back to the genetics just a little bit with the BRCA1 and BRCA2. That is not something that we hear routinely everyone to jump and get tested for. So tell us, Dr. Braden, a little bit about who would be at risk for, or who should maybe talk to their physician about being tested.
So as Dr. Johnson was saying, it's actually a relatively small percentage of folks that will have that mutation. Certainly if you know that mutation's in your family, you need to look further into that with your medical provider. Even if you don't know the mutations in your family, if you know other family members that have been affected by especially breast cancer, ovarian cancer, or other types of cancer in the family, and you may not be sure if there's any genetic component, you should definitely bring that up to your provider, because the BRCA1 and 2 mutations are associated with other types of cancer, for example, prostate, also in men. But there are other genetic factors, other genetic problems that can be associated with many types of cancer, including breast cancer. So.
And this has been a little bit more, there's been a lot of media attention, obviously with famous people being tested,
Right.
and we should actually mention how you're tested is really through lab work, correct?
Yes,
So
that's
that is
right.
actually blood work that you talk to your healthcare professional about having drawn, and if that's something that needs to be done based upon, again, your family history, your personal history, and working with your primary care physician to see if that's something that you need to be tested for.
And oftentimes we will also refer folks to genetics counselors if we think that the patient is high risk for having this mutation, or if they come back positive for the mutation. And the genetics counselor sort of helps discuss with the patient the implications of having the mutation.
So we've talked a little bit about that testing, but then also I heard you mention women need to get to know their breasts and do
Right.
some breast self-exams. So what are some steps that we can take, Dr. Johnson, as far as, we've talked about the prevention part, but what are some things that we can do to be active, because it's not necessarily always related to our family history?
Right. Knowing what your breasts feel like on a daily basis. It's really about a week after the start of your menstrual period is when you would want to do the exam, and you really should know month to month on that same day, how do they feel. That way you have a consistent comparison. And all breasts have lumps and some even granular feeling tissue beneath the nipple, but it's knowing, is this a new lump? Does this feel different than it did last month? And that's when you really need to go into your doctor and let somebody know, hey, I feel this and it feels different.
Right, so that's really what we hear the term BSE, breast self-exam. So we need to do that on a monthly basis. I'm hearing you say 7 to 10 days after you finished your menstrual cycle. There's also a second part I've heard, clinical breast exam. So explain a clinical breast exam to us, Dr. Braden.
So the clinical breast exam is actually what's done by your healthcare provider. So typically it's recommended for average patients that every year when you go in for your physical exam, your mammogram, for example, you also have a clinical breast exam, which is the healthcare provider examining the breasts as well.
And then the third part is the mammogram. And so we know the mammogram is very important. And, you know, we hear a lot of rumors about mammograms, but they are very important in a low density way of actually taking a good look at the breast tissue. So tell us a little bit more about mammograms, Dr. Johnson.
Mammograms do not hurt. They may be a little uncomfortable for just a brief moment, but I've had one. It's not that bad. And it's super important because they can see things and detect things you can't feel. And most of the time it's a significant difference in the size of the tumor or the lump or the mass, and what's going to be picked up on a mammogram and what you're going to be able to feel. It's going to be significantly larger and more advanced when you feel it, as opposed to finding it on a mammogram. And having a set of screening mammograms, the ones that are advised every year, then they have something to compare it to. So they can actually follow your mammogram.
Absolutely. So this is the way that you can look at early detection, not only knowing your own personal breast through the breast self-exam, the clinical breast exam through the healthcare provider, but that mammogram is in there to take that early detection at a very early potential stage, and also rule out breast cancers too.
Right.
Now, I heard you mention that breasts can be kind of lumpy and bumpy, and that tissue is normal. We hear a term called fibrocystic breast. What are the risk factors for an individual that has fibrocystic breasts, and what actually is that, Dr. Braden?
So fibrocystic breast, it's basically normal tissue. For an individual who doesn't necessarily feel their breast very often, it's going to feel different than a flat, soft tissue. It's very hard for a person to tell the difference if they're just feeling their own breast. But it's something that as a healthcare provider, you've become very used to telling the difference. If there's any question with any changes in the breast at all, bring it to your healthcare provider, of course.
Absolutely. Now, there's a lot of controversy with the actual age that someone should start having a mammogram. Dr. Johnson, what are the recommendations currently?
Currently it's age 40, and it even varies between different societies. But usually women who are under age 40, they're going to have very dense breasts, and so you're better using an ultrasound. But once you get above age 40, some people say 45, but I would stick with the most conservative recommendation, and you really need a mammogram once a year.
Once a year, absolutely.
And that may change. It
Right.
changes almost.
There's a lot of different controversy out there, but generally I believe the American Cancer Society and National Cancer Institute and those types of organizations are recommending the 40 age bracket. So that's something, again, to talk to your healthcare professional about, and I'm sure earlier age based upon your family history too.
Yes.
One of the issues is that younger women tend to have more dense breast tissue. So once you talk to your healthcare provider and you're able to get an individualized risk assessment, some folks will actually have MRIs as well. That's not standardly done for everybody, but a breast MRI is a good way to take a look at the breast tissue in folks that have really really dense breast tissue, if their lifetime risk for breast cancer is determined to be higher than the average.
Well, we've been talking a little bit about detection, so that would be the breast self-exam, the clinical breast exam by your healthcare provider, and then again the mammogram. We've heard the word ultrasound. What about breast biopsy? Is that a way of detection too?
So breast biopsy certainly is a way of detection. It's not standardly done on everybody. Usually you start with the imaging. So you feel something abnormal, the physician feels something abnormal. We start with the standard imaging, as Dr. Johnson was mentioning. If something abnormal is found on the imaging, or if there's just a really high clinical suspicion for something abnormal, the really one and only way to know exactly what you're dealing with is to stick a biopsy needle in there and let a pathologist look at it under the microscope and do special tests on it to tell us what it actually is.
So there's a lot of different ways out there. There's also some personal responsibility we've talked about the risk factors. When we talk about risk factors that we can't change, obviously we can't change our age. So as we age, are we more at risk for breast cancer, Dr. Johnson?
Yes, specifically once you get above 55 to 60. That's when it really becomes more significant. And again, you can't do anything about age except be more vigilant about getting your screening mammograms and doing your exams.
So we have to take an active role in being a partner with our healthcare professional, knowing our own risk factors, family history, and then making sure that we are taking steps to prevent breast cancer by leading a healthy lifestyle in general, correct?
Right.
Any advancements as far as treatment for breast cancer, Dr. Braden?
Well, from the medical treatment side, the chemotherapy side, there's constantly advancements. The one thing that comes to mind is the recent advancements in one specific type of breast cancer called HER2 positive breast cancers. There's numerous drugs that have come out recently for treatment of that within the past few years. So it's hard to talk about specific advancements in treatments because there's continuous research and going on, and so there's always clinical trials and studies with new information coming out about drugs, fortunately. So.
And I think we need to point out too that breast cancer is different for everyone.
That's right.
It's not the same for every individual, and of course, being a physician in that area too, there's something called staging.
That's
so tell us a little bit about staging.
Sure. So anytime that somebody is diagnosed with a breast cancer, the first thing we need to know is what type is it and where is the cancer, because as most people know, cancer can start in one place, but it has the ability excuse me, to frequently spread to other parts of the body. And where it is located, that's what determines the stage of the cancer. So in breast cancer, we have stage 1, 2, 3, and 4. And each stage can be treated somewhat differently. And so we have to know the stage of the cancer prior to knowing exactly how we would treat it. So oftentimes the lump is found in the breast. It's biopsied, it's confirmed cancer, and then the next step is often another procedure to look for the cancer locally in the lymph nodes, for example. And then the next steps would be if cancer is found in the lymph node, is it possible that it has gone somewhere else? And so we may consider looking further. So I won't talk too much into detail because it does depend on what we find from the the initial staging procedure. But there are different stages. Different stages are treated differently.
And I think we hear the terms too, invasive or aggressive, and it depends on the type of cancer and the growth. Is that correct?
That's right. And the pathologist, when the biopsy is done, gives us a lot of information about that.
Absolutely. So it's really individualized, and that's something, again, once it is diagnosed, working with your healthcare professional and making those decisions for what is best for that individual, whether it be chemotherapy, radiation, surgery, the different types, and so it's different for everyone.
And usually it's a combination of surgery, radiation, chemo, and you really need to find someone that you're comfortable with, because it's a long process from the time of diagnosis to the time of, yeah, you're done, and now you're just a survivor who's waiting to go on with the rest of their life. And if you don't have somebody you're comfortable with, it can really make a difference.
So I hear you say definitely too, not only that partnership, but again, as we've been talking about with the physician, but really making sure you have a good support system for people that are going to be there with you to help you definitely through this process.
And there are a lot of support groups for breast cancer.
Absolutely. Now we also know that there are a lot of myths that are out there too. So Dr. Johnson, tell us about how we can dispel some of those myths related to breast cancer.
Okay. Tons of myths. I get asked questions every day. Do bras cause breast cancer and wearing them 24/7? No. There was somebody who said maybe that they obstructed lymph flow in the breast, and that's never been proven. Some of the other myths pertain to mammograms, that they hurt, that the radiation from the mammograms can cause breast cancer. You probably get more radiation in a flight to California, just getting screened on and off the plane every time you have to stand. That breast cancer is painful. Most of the times it's a fixed lump that is not painful. Fibrocystic disease, like we were talking about earlier, is painful. And so people will come in very concerned that I have this area and it really hurts, or my breasts are hurting. Does that mean I have cancer? And no. Usually cancer is painless. It's a painless fixed lump. Another fairly common question is, are all lumps cancer? And no. The majority of lumps and masses that we see in clinic and even that we biopsy wind up being benign. But it's those people that you catch that do have cancer. That's the ones we're trying to find. So not every lump is a cancer. Another myth is, if my mother has it, I'm for sure going to have it. And again, it's very individualized, and unless you're one of those few people who fall in that 10% of having a genetic mutation, then your risk is, I think, 2 times more if a first-degree family member has it. If more than one first-degree family member has it, it's 3 times, threefold. But it's certainly not a guarantee diagnosis.
Yes. Now what about, and I'm thinking as you're saying that too, we hear breastfeeding and the connection with breast cancer too. Are you at higher or lower risk if you breastfed your children?
I believe if you breastfeed your children, you are actually at lower risk for breast cancer. So,
and then also if you have had children or not have children.
That's true, and I actually missed this one myself, because if you don't have your first child before age 30, they believe that you're at increased risk, and I missed that mark.
So I think
so. I've dinged myself there, but
well, and I think that again falls back with the hormones. Is that not right?
It is.
It's
anything that increases your estrogen exposure over your lifetime. So, women who have early menarche or start their period before 12, who have a late menopause, the more menstrual cycles you have in your life, they believe that increases your risk. So more pregnancies, you have obviously less menstrual cycles. Breastfeeding can prolong the time when you're not having a menstrual cycle. So anything that you can do that decreases your overall estrogen exposure. Oral contraceptives are actually birth control pills. They have not been shown to have a significant increased association with breast cancer, but there is a small risk that is associated. And they say that once you stop them, though, however, that risk declines. So
definitely really looking at what you are doing personally. We've been talking about it being very individualized, and knowing what you're doing in your lifestyle, what medications you're taking, making sure that you are taking those prevention steps by doing the breast self-exam, the clinical exam, and then also the mammogram, and having that starting at about age 40 is what I'm hearing what we can do. So these are great tips for women that are trying to look at their own risk factors for breast cancer awareness. Dr. Braden, anything else you'd like to add?
In terms of myths or?
Just general.
I think just the important thing is healthy lifestyle. Look at your own personal risk factors, as we discussed throughout the show today, and talk to your healthcare provider. You know, get in there for your yearly mammograms and your healthcare checks. If you notice something abnormal, one of the things I hear pretty commonly in the clinic is, I felt something abnormal in my breast for, X amount of time, but I just kept telling myself it had to be nothing to worry about, and what you're doing with that is potentially delaying a diagnosis, delaying appropriate management for a cancer. So as Dr. Johnson was saying, most lumps aren't going to be breast cancer, but we can't know for sure, we can't deal with it until we know what it is.
That was a very good point. Dr. Johnson?
I completely agree. Ignoring a lump or a mass is not going to make the problem go away. And if it does turn out to be a cancer, then you obviously want to get treatment as soon as possible so that you have the most options available to you, both from a surgery standpoint as well as a medical standpoint. And also, if you're a mother, you want to know so that you can take care of it and
be a good role model.
Be a good role model for your daughters, or if you're a daughter, so that you can let your sisters know, or because it doesn't just affect the one person, it affects the whole family.
Absolutely. Yeah. And survival rates generally go up if you find it at an earlier, stage. So that's very important too. We've been focusing a little bit more on breast cancer with women, but we also know that men are at risk for breast cancer too. Dr. Braden, let's talk a little bit about that.
That's right, and I think that's certainly a myth that we could bust today, because a lot of men and some women also don't know that men are in fact at risk for breast cancer. So obviously the incidence is much, much lower, but men are at risk if they have family members affected, so there can be genetic components there as well for men, but men can also develop sporadic breast cancers as well. It's oftentimes treated similar as it would be for women, but it's important for men to know that it can happen.
Absolutely. We've been talking too about doing the breast self-exam, and I think generally women think that it's just in the breast area, and I do want to stress that there are other areas that they should go to, such as underneath their armpits. So Dr. Johnson, tell us a little bit about, they should actually check underneath their arm area. They should actually check underneath their arm, check the breast both sitting up, lying down, and the most important thing is to do it consistently at that time of the month, every month, and that way you know, because your breast will fluctuate with your menstrual cycle. And so if you try and do it at different times of the month, then you may feel something and be like, oh no, and you really need to keep it consistent. And absolutely, we've been discussing how we are empowering all of us to take active roles in our health care, and by doing the breast self-exam, you're learning a little bit more about your own body, and also the lifestyle risk factors, and the choices that we make every day really do affect our health. So again, this is a very important topic, something that you need to talk with your healthcare professional about, again, to make sure that you know when you need to start getting the mammograms, what your risk factors are, and then seek the treatment that you definitely need. And I definitely hear that don't be scared. It's something that you need to get in and get checked as a routine health issue for women. So we appreciate both of you being here with us today and sharing this information. For more information regarding breast cancer, we invite you to go to www.hmh.net, click on Health Link, And for our service providers also, there's a tab up at the top to find how you can locate our service providers in our area. Thank you for joining us, and we hope you tune in next month for another important edition of Health in the Heartland.